Hi, this is Dr. Yoon Hang Kim. I'm an integrative and functional medicine physician, and I'm also an expert in LDN. Today, I'm responding to some questions about pain and LDN, and request was to go beyond LDN. So, LDN and pain in general, there are multiple mechanisms why LDN can be helpful. I think increasing the endorphins in the long run, I think it resets the pain perception, and it gives body better ability to handle pain by itself. And then the second mechanism is the microglia inhibition, where microglia functions as a super inflammatory modulator or promoter. LDN kind of blocks that. So, number one, we have increase in endorphins, which allows individuals to handle pain better. Number two, we have this ability for nerves to calm down. And those two alone, I think, do fantastic job. And especially when it comes to nerve pain, especially trigeminal neuralgia or post herpetic neuralgia, which is what happens to some people when they um, go through either in trigeminal neuralgia, they don't really know why, and post herpetic neuralgia, that means you had shingles or reactivation of shingles virus. So, and generally, I just start them very, very low, especially if they're taking opioids. I start them on 1 microgram whenever they take opioid, and I just go up very slowly. Otherwise, depending on the endorphin reserve of an individual, which is not a lab testing, but just talk to patient and find out how functional they are. If they're very functional, then we can you can start maybe at 100 micrograms, 500 micrograms. That's the decision of patient, and I think it should be a shared decision making between the physician and patient. But I don't, if I don't know, I'm not sure, I go to 10 microgram or even 1 microgram. The purpose is side effects. I don't want side effects to be experienced in my patient population, because that often means they'll stop it and they would not be open to restarting it. So they asked, the question was, what do you do if LDN isn't enough? So there's a lot of tools that I have in my toolbox, and unfortunately, they're not general tools. They're very specific tools. Like there's a liposomal curcumin product that I found to be superior than anything else that I've used for the purposes of treating pain. There's a Chinese herb called Corydalis that has very unique properties of treating nerve pain, and again, there's a specific formula that I use. So those two can be very helpful. Another thing that can be very helpful is a neurostimulation device that is capable in 30 days to kind of reprogram the pain center in the brain and make the pain irrelevant. There's also styles, specific therapy styles known as neuroanatomical acupuncture or neuroanatomical approach to pain, that attempts to reset the brain using acupuncture needles is as a way. And all these I have been learning, developing over last almost 3 decades, and um, overall, it has done fantastic job, enough for me to create a integrative pain management program in a huge HMO based system, and take on all comers and get about 70% pain relief. Um, in I mean about 70% pain relief in 70% of patients. So um, I would say if you have chronic pain, don't give up, and do what you can to um, find someone who can help you. And if you're in Texas, contact me. and I can see you uh, either in in a Texas city, small city near San Antonio. Well, thank you so much. And if you have pain, I do wish you the very best, because I started this endeavor because I was a chronic pain patient, and all the things they recommended, medications, injections, surgeries, backfired. And at some point, I decided that I have to find my own path. If I just depended on medical advice, I would probably end up disabled today. So, thank you. And kindred spirits with chronic pain, um, look for tools and look for healers that can help you. Thank you. This is Dr. Kim.